here. So agenda, we're going to have a couple announcements. Our epidemiology department is going to go over the new respiratory disease prevention guidance update. And then our community mental health and addiction program will also have a presentation, and we'll give a little bit of time at the end for a Q&A. Just for everyone's transparency, we will be having these meetings have been updated from 30 minutes to an hour, but we'll talk a little bit more about that near the end of the call. So a couple announcements. Narcan. If you or your school is in need of Narcan, please reach out to our school supports team, and we can get you connected with there. We have COVID test kits still available for pickup in the warehouse. The link is there. We'll also be sending this as a PDF out to all of you at the end of this meeting for any of the links. Scheduled on-site COVID-19 vaccinations at your school for staff and students. Please contact our vaccine equity program to organize a COVID-19 vaccine for a COVID-19 vaccine clinic. And then one more thing is that our Pima County website is being updated currently. So please look out for that. We will notify you once that is ready. So our epidemiology, I will turn it over to our epidemiology division to go over the new respiratory guidance. Elena?
Good afternoon. Are you able to share control with me, Christopher? Maybe you already did that.
Let me see if I can. If not, you can just hit the next slide you can just tell me when, and then I can go ahead, and while I figure that out, you can just move forward.
Absolutely, no problem. Well, good afternoon, everybody. My name is Eliana Costa Zavala. I'm an epidemiologist here at Pima County Health Department, and I've joined to share with you a document that we put together summarizing school year 2023-2024 respiratory disease prevention guidance for schools here in Pima County. I believe the document that does cover this guidance, everything written out and the links available, will be publicly available in our website. Christopher might have already covered those details, joined a little late. Apologies if he did. But just want to make sure you all know where that is. Let me try this next. Yeah, Christopher, I'm ready for the next slide. So just a quick overview of the guidance. We are covering some prevention strategies. We know that schools are still able to have some COVID-19 testing on site, as well as support from ADHS and Pima County Health Department on that. So we wanted to cover any updates regarding that, as well as a section on reporting, have some clear guidance on outbreak response, and make sure that the contact information for epidemiology is also available, as well as questions. Next. As you all know, even better than we do, back to school is right around the corner. School setting should continue to take appropriate steps to mitigate respiratory illness and keep staff and students healthy and safe. And we're trying to move away from COVID-19 alone prevention to include some other morbidities that we also see in our community and school settings. And just to mention, influenza and RSV come to mind first, but all of those sort of morbidities that affect our school children primarily. So these are just a set of recommendations that, like I mentioned earlier, are all written out for you with linked resources, and that should help guide you through the upcoming school year. Next. As far as prevention strategies, we do have a listed slide for all of them. The vaccination is a huge one. As you all are familiar, there is required vaccines for back to school. ADHS does mandate them, and the state of Arizona regulates them. There is some for kindergarten, some for grade 6. Please continue to submit your IDR reports as per ADHS guidance. Please continue to encourage your school children to stay up to date on vaccination, same thing as parents. Some measures that you might consider implementing, and Christopher, I know already provided the resource for one of them, is potentially hosting a vaccine clinic within your school community for students, staff, and their families, as well as emphasize the importance of routine childhood vaccination, as they do play a very important role in preventing various illnesses and outbreaks. Within this slide, you can also access in the guidance as well, the link to our immunization portal at Pima County Health Department with some more resources that you might be able to share with your community. Next. This is also another resource we wanted to make sure to share. Most of you might already be familiar with it, is the Healthy Kids Arizona mobile app. The links are here, but it includes really nice resources to very common mandatory and not mandatory reporting morbidities with clear information on one pager. Also, if you have any reporting requirements, questions, some of that is covered on there. It's a resource that's been available for a couple of years. They do have vaccine information as well as some basic prevention of infection resources. Please check it out if you already have not. You should be able to download it, I think, both on like the iPhone version and the Android. And if that is a little bit complicated and you prefer to have just maybe a PDF or something more concrete available, the flip chart, which is the second link on the slide here, does cover some of the information on the Healthy Kids mobile app. And it's just something that you might be able to just print out and have handy at your school office. We have had a few comments, and there has been some suggestions on some guidance that needs to be updated. And if you ever hear anything like that, please communicate with the school team. They can communicate with ADHS as well on anything that might need some clarity or further clarification. Next. As far as another prevention strategy that we do have available for schools and any sort of indoor setting, this has not changed. These are the same recommendations that were available over the last couple of years, but to continue to enhance air filtration and disinfection according to CDC's guidance, many schools have already not just considered, but purchased multiple air filters. So that is definitely a tool that's available in classrooms and indoor settings. As far as some practical steps to optimize indoor quality, the EPA Clean Air and Building Challenges actually has sort of a toolkit that you can utilize to evaluate some steps that you might potentially be missing. This is not a new resource, and if you've already utilized it in the past, it still continues to be available, but it has not been updated in the last year or so. Other guidance that continues to be helpful and might not be so reliant on technology, but it is reliant on our outside weather, is potentially keeping doors open to allow increased ventilation, especially in school buses and vehicles. Like I said, being mindful of the weather conditions outside. And then also another tool, if you say, or if you may, on your toolkit is to conduct some activities outdoors as possible. Next. This is also another prevention strategy that schools are doing amazing at sharing with their school community, hand washing and respiratory etiquette. Please continue to teach and reinforce proper hand washing with your kiddos. Multiple posters are available if you want to utilize them in your school settings. From the CDC, I want to say the link to this poster is within our slide. We also have some from our chef's teams that cover hand washing and when, how long to hand wash to have near our sinks, etc. Not just important for preventing respiratory disease, but also some of those viral gastroenteritis and GI bugs. So continue to reinforce with kiddos and staff to have hand washing time at different intervals before eating, after using the bathroom, after coming back from break, etc. And then making sure that you have sanitizer available in multiple areas such as classrooms, bathrooms, and hallways continues to be important, as well as covering coughs and sneezes when they happen. Another one that is always covered in school posters is please avoid touching eyes, nose, mouth, germs spread this way. These are very clear messaging that we share with all age kids, that we want to bring back some of that health promotion that is applicable not just to prevent COVID-19, but all respiratory morbidities. Next. Another one that is in your toolbox is making sure you can relay to kiddos this clear message of staying home when sick. Whether it be respiratory or more vomit, diarrhea symptoms, please make sure to share with parents. And I know that schools are already doing a great job at doing this, but making sure that kiddos are staying at home if experiencing any sort of cough, fever, sore throat, vomiting, diarrhea symptoms. When appropriate, it is recommended to conduct tests for COVID-19, influenza, or RSV, with a caveat that some might be available at different schools and some might not, and also if resources permit. But if test result is negative and a kiddo is still being symptomatic and showing some of these common illness signs, the recommendation does continue for them to stay at home until their symptoms have resolved. And if the individual, the kiddo staff member, thus tests positive to whatever morbidity it might be, just some common respiratory ones listed on the slide, then you would adhere to disease-specific guidelines. As far as COVID-19, the disease-specific guideline has not changed in the last year, if not more. So that will continue to take place as per CDC guidelines. And it has not changed for influenza either. This will be important in order to be able to support this, to have some flexible and supportive sick leaves, so that employees may stay home or take care of an ill staff member or an ill family member, etc. And within the guidance, we actually have linked the recommendations should anybody test positive to any of the morbidities that I just mentioned, so you can quickly access the recommendation that you can share with that sick staff member or sick kiddo as needed. Next. Another, if you may, tool in our toolbox is going to be surface cleaning. This is already something the schools are doing a great job. This is not news, but please try to maintain a safe and sanitary environment. This will help with the mitigation of not just respiratory illness, but also GI illness. Make sure that you're utilizing those EPA-approved products that will eliminate target pathogens. EPA has lists of cleaning products that are approved for different morbidities that you can check your product on. If you ever have a question with that, please reach out and we can share the link. I think we also included some of them in the guidance as well. And having that increased cleaning, especially of highly touched areas, like I mentioned, will help prevent illness. It promotes healthy environment for all kids in schools and staffs. If you have any further questions with that regard suitable cleaning products or have any issues accessing this EPA site, you can also consult our consumer health and food safety team, and we can be sure to, or they can be sure to lead you in the right direction to check for the necessary resource. Next. We did include a small section specific to COVID-19 due to, like I mentioned, schools still, some schools still having the resources necessary to perform some testing within schools. And so as far as diagnostic considerations, schools can continue to perform CLIA wave tests. And that is going to be those at-home tests. We are still able to share them with schools, and ADHS is also sharing them as a resource for as long as they have the availability to have the test to share. Another option for diagnostic is for your school children or staff or visitors or families to visit our community testing center, and the link is there in our Pima County Health Department website. You can click on it or share it with a school member. And it does have options of where testing is taking place in our community if they want to make use of that resource. Another option nowadays is also that they can perform at-home tests themselves. I know some schools are able to share those at-home testing kits with their with parents and families, so please continue to do that. And if they need any instructions, we do have them available in multiple languages. This has not changed, with the caveat that this testing resources continue to be under an emergency authorization. And should that at some point expire, we will be communicating with you to update on what further steps would be. As far as screening, just one easy way to think about it is this kind of community, more widespread testing. At this time, it is no longer recommended in K-12 school settings, but it could be considered if at some point COVID-19 hospital admission levels become high. And for that, I just want to have next slide, please. I want to have just a little bit of a data talk here. This is our COVID-19 hospital admission levels with public health emergency ending in the beginning of May. We did lose the ability to have some of those reportable data sources on the national, local, and state level. Some of those dashboards went away, and some new metrics were shared with our different communities. This is one that has been introduced as a public health emergency ending, and that's the COVID-19 hospital admission level. And you can check it out by accessing the link that is on this slide. You can look at, if you hover over with the mouse over Pima County in the state of Arizona, you will get the little box that I included on the slide, and you will get the very last line on there. It says COVID-19 hospital admission level low. So it has been in the green for, I want to say, most of the summer. And if you look on the main page, you will see some of the common recommendations at this time. Now, I have not seen it in yellow or red as of yet, and I'm not saying it will be. Hopefully, we'll be able to prevent that. But those recommendations will change, and I can go into that in the next slide. And so when I mentioned that screening testing, that a little bit more widespread testing, while it's not recommended now, should we come into a period of time during potentially a respiratory season, those winter months, in which this level changes into high or color red, there might be a time in which this screening testing might be recommended in K-12 settings and other high-risk settings. Next. Together with this high COVID-19 hospital admission level, would be another recommendation that schools are probably familiar with, but at some point in the previous years, the screening testing was considered for high-risk activities where masking was not recommended or as effective, such as indoor sports or extracurricular activities. And so it is another thing you have available in your toolbox during these times of high COVID-19 hospital admission levels, should they happen in the future, that you could consider screen testing for this particular activities. You may consider temporarily halting this activities, and that is something that we're going to leave down to the schools. But also, we do have some other tools in this toolbox that I was talking about in order to mitigate this transmission, such as masking, hand washing, social distancing, etc., that can be implemented should we come to this high COVID-19 hospital admission level, which, just to be clear, I'm not saying we're there right now. We're on the green. This is not currently recommended, but just something that we want to make sure that everybody in school settings is aware is a potential something to happen in the future should we see increased transmission during respiratory season. Next. This is a very dense slide. I apologize, it contains a lot of information. We're on to the next section of reporting. If a school is conducting these CLIA wave tests, those at-home tests, be it for COVID-19 or for other morbidities, some might have, I don't think I've ever heard of a school having the ability to conduct influenza, at least not in Pima County, but if you do, please let us know. We're curious to know more. But there are some CLIA wave tests, those rapid antigen tests that you might have and that your school staff might be licensed to perform. Then if you are under this scenario, then you not only have the reporting requirements as a regular school, but the laboratory testing requirements for reporting also come in hand. And so all of this information is going to be on the guidance that we're sharing with you, so you can take your time reviewing, and please let us know if any questions. But what it boils down to is if you are having staff proctor this COVID-19 or influenza or RSV test, you do have a mandatory requirement that requires that the facilities in this umbrella would be schools conducting this test, which are rapid antigen tests, for them to have to report them. And in order to report them, you can follow a couple of different avenues. You have the point of care reporting form from ADHS, and you have simple reports. I know a lot of schools are familiar with simple reports. The information is already here. If you have any questions, you can reach out to epidemiology, or you can reach out to Arizona Department of Health Services. Thank you for highlighting there. By contacting the email on this slide. If you want to make sure that your CLIA waiver is updated, that who is the point of contact on there, is that reporting mechanism working, you can direct all those questions to reporting questions at acdhs.gov. And this one's a common question, and that's why I included it here. At-home tests that are being conducted at home and not necessarily proctored by school staff, but maybe it's like mom and dad interpreting the test and my train of thought here, and administering to their family member. We also continue to have the online self-report form that is available in the Pima County Health Department, and it's not a requirement, just a recommendation. But we do look at that data to kind of give us a little bit of awareness on positivity in at-home tests, which are not reportable. One thing that I failed to include is obtain parental consent if schools are testing and also for reporting purposes. I think I covered everything on this slide. Like I said, please take your time reviewing the guidance and let us know if any questions on anything we might have overseen. Next. So this slide covers other communicable diseases that are reportable by schools. I included the listing on the right side of our slide here, but the link is also available on the slide. So school and school administrator, child care establishments and shelters are required to report these diseases per our Arizona Administrative Code as listed on the slide here. Different morbidities have different reporting timetables. The key includes when you should be reporting some of them, and then how to report them. You can utilize the CDR form or an outbreak report form, or just call our epidemiology department and we'll be sure to assist and go through a series of questions that are unique to each morbidity you might be reporting. I'm sure this has not changed in the last couple of years, but I wanted to make sure that it was included in this presentation. Next. Jumping ship a little bit onto a different aspect of our guidance, outbreak response. Schools have done an amazing job reporting potential suspected outbreaks, increased transmission in their school setting. And since we're trying to make this guidance, not just COVID-19 specific, we wanted to include other respiratory outbreak definitions. They can be found in the link. But generally, since we're talking respiratory, unknown respiratory etiology, outbreaks can be suspected when you're looking at 5 cases or more. I did have some conversations with multiple either school administration staff to try to update them on what ADHS was planning for this outbreak definitions. And while I was looking forward to a potential update and the definition to increment that number of cases from 3 to 5, it has not taken place as of yet. If we hear any sort of update, we will reach out to you through the school team to make sure that this guidance is clear. But for COVID-19, since schools continue to test, and if you have the resources available and have the suspicion, an outbreak of COVID-19 is defined as the occurrence of 3 or more K through 12 associated cases within a 14-day period, which are epidemiologically linked. And by that, we mean in the same subgroup, so in the same activity and the same sports team and the same single classroom, etc. We have not made an update to our reporting process, and we have the link available on our Pima County Health Department website for outbreak reporting for COVID-19. We are hoping to get some input later in the upcoming months to potentially include some of these reporting methods to other morbidities. I have heard great response from school staff and health aid offices that have become really familiar with the process of sending some of these reports electronically via surveys. So more to come on that aspect. We are working on it. We do appreciate all the time schools spend reporting some of these suspected outbreaks, and we're here to help provide guidance should another one take place. I always say, hope I don't hear from you, but if it's needed, epidemiology is here to support schools. Next. The strategies that we are going to recommend to reduce transmission should an outbreak be confirmed. These come from the guidance for COVID-19 outbreak prevention. However, I wanted to be sure to share with everybody here that they are not just for COVID-19, but they can be applicable to all respiratory illnesses. Some schools might choose to recommend the utilization of masks, quarantine. So contact guidance for COVID-19 and thus is still included. Other tools that you might have, we already covered in the prevention section, but improving ventilation, conducting school activities outdoors as possible. This is also another scenario in which you might choose to implement screening testing as a recommendation. And as an update on case investigation and contact tracing, I'm not sure how many schools are going to have the ability to have contact tracing for this upcoming school year, but we continue to have the support from ADHS for reported COVID-19 cases for their rapid response team to conduct case investigation and not just gather some important COVID-19 details, but also connect community members with resources as needed. So you can, if you get a call or if anybody in school community gets a call after testing positive for COVID-19, that is potentially happening and should, from what we have heard, there is resources available at least through the end of the year. Next, please. As far as outbreak response, masking continues to be a tool in the toolkit to prevent transmission of COVID-19 and keep kiddos in school. So it is very important for well-fitting masks to be utilized should this be the recommendation. Close contact of COVID-19 still have the same mask wearing recommendation that has not changed. And we have not changed our recommendation for mask wearing in the nurse's office. A mask may be worn at all time, regardless of those COVID-19 hospital admission levels, but it's going to be up to each individual school to make a decision on the policy for them to be worn in a school nurse office. As far as individuals who are immunocompromised, masking might be recommended at a little bit of a lower hospital admission level, and that's going to be that yellow medium level. So please be sure to accommodate any individuals who are choosing to wear their masks at different times and have your community be mindful of this potential for mask wearing, not just at high COVID-19 hospital admission level time. I already mentioned that should we come to a high COVID-19 hospital admission level, universal masking might be or is advised for schools and early childhood education centers. This matches what the CDC and ADHS are recommending. And also one of the last points, but not least, is should there is some settings that facilitate education for high-risk students. So implementing modifications to ensure everybody, including students with disabilities, can access in-person learning is going to be a key measure and a continuation of our classes and doing so in a healthy way and preventing illnesses. Next, please. I think I'm almost through all the guidance. There is additional resources included, COVID-19 resources for schools, and the link to request kits from Pima County Health Department, and that is COVID-19 self-test kits, as well as some resources available from CDC and ADHS reporting requirements and that Healthy Kids app that I was mentioning on this slide. All of these resources are also included in the PDF guidance that you should all have access to if you don't already have access to. Next. Another thing we wanted to include, should you have any reporting questions that can be addressed by either school team or some of the other point of contacts we have already mentioned, is our epidemiology contact information. Our email is epi@pima.gov, and this is monitored regularly and sometimes the quickest way to contact somebody in our epidemiology team. Our phone and fax number are also here, and I also included the communicable disease reporting for schools link should anybody in your staff require it. Next. And I think with that, I can move on to the next section. So back to you, Christopher.
Thank you so much, Elena. So next, we're going to be having our community mental health and addiction program speak. Okay, I see.
Okay, perfect. Thank you so much, Chris. So brief little introduction. My name is Leah Morales. I'm a program specialist for the Community Mental Health and Addiction Program. And I'm just mainly going to be going over what we do overall with the program, as well as focusing on one of our programs that we're going to be recruiting for. We can go to the next slide. Okay, perfect. Thank you. So a little bit about our team. We are a team of about 13 people. We have 2 program managers, 2 case managers, some program specialists, as well as first aid instructors, and an epidemiologist and a fatality review coordinator. So right here on the screen, you have the different aspects that we focus upon. First one is going to be that overdose response and overdose suicide fatality review. So with this, we track where overdoses are happening, where we need to distribute Narcan, also known as naloxone, within the community. I know Chris talked about getting Narcan within the schools. We primarily focus upon the community as a whole for distributing that Narcan. We also work closely with emergency departments, MAC clinics, EMS, pharmacies, just with Narcan distribution. And then again, it helps us discover where we need to allocate that Narcan. For epidemiology, we primarily surveillance current trends. We also implement this data into our trainings and presentations. And we investigate certain overdose cases to look for any commonalities or trends within those. In terms of harm reduction, we provide Narcan to those targeted areas. Our case managers do a lot of outreach to MAC clinics as well as transit centers, trying to get those individuals that are at high risk the necessary resources. And then outreach, that's primarily going to be my focus. So we do a lot of these collaborations, jumping onto these meetings, giving you all this education and these resources. And then I'll be talking about some presentations that we provide as well. I'm going to go to that next one. Okay, perfect. Thank you. So right here is a list of all of our presentations that we offer. This can also be found on our website. So that's going to be pima.gov/mental health. I can put that in the chat later as well. But we offer a chronic pain self-management program, which is a 6-week program designed for those who suffer from chronic pain, as well as caregivers to those who suffer from chronic pain. Teaches them how to regulate those emotions and teaches them exercises that they can do. For mental health first aid, that's going to be our 8-hour class. Really encompasses everything in the mental health aspect, teaches you to be that first point of intervention for someone who is suffering from a mental health crisis. NAMI Ending the Silence is geared towards those middle schoolers and high schoolers, gives them that general overall knowledge for mental health. QPR training, that's going to be our suicide prevention training. It is around 2 hours long, and we offer it for anyone who's interested. We try to offer a public one once per month. So we do have one scheduled, and I will be giving you more details about that at the end of this presentation. Same with Rise of Fentanyl. We try to do one public one per month as well. And Fentanyl, A Killer Among Us is going to be the Rise of Fentanyl, but geared towards the youth population. So this is where we go into the schools. If I do have any teachers that are on the call and you are interested in this, please feel free to reach out to me. We can try to get you set up and scheduled with one of these trainings. Our Narcan training is geared towards adults, so if anyone is interested in that, if you have Narcan and you just have more questions about it, how to use it, or you just want more data surrounding that, that's where that's going to come in. For general mental health well-being, we offer a stress management course. Again, everyone can kind of benefit from this. Some things a lot of us do practice already, but it's good just to kind of freshen up on those skills. And then lastly, so I'm mainly going to be promoting our Strengthening Families program. That's what we're going to be recruiting for right now, and it does start in a couple of weeks. If you can go to the next slide. Okay, perfect. And then you can jump to the next one. So Strengthening Families program was developed by Dr. Carol Comfort in the 80s, I believe it was 1982, and it was geared for substance abusing parents with children ages 6 to 11. And it was mainly brought up to teach these parents skills on how to keep their kids alcohol and drug free. So that although it was designed for 6 to 11 years old and originally it was a 14-week program, we've kind of altered it a little bit. Again, this program's been around forever, so there's slight variations of it. For our team, we offer an 11-week program, and it's geared for kids ages 7 to 17. So it gets more of a wide range of them. And so we try to promote it as being great for anyone. So it's not just for families who are at risk for abusing substances. It's great for any family who just wants to help improve those communication skills, setting healthy boundaries, those listening skills. Okay. And so right here, I just want to talk a little bit about the risk factors that someone could come across. It's going to be the risk factors that maybe if you do have these, it would be great to get enrolled in this program, such as neglect for the kids, substance use, again, by the parents or the child, having stressful life events, exposure to violence or abuse, low expectations. I know some of the, what are they called? Some of the different school districts, they aren't really promoting as much homework. I know a lot of the parents have come to us with that, kind of saying like, oh, like this is a great program to kind of have those kids have a routine. So that is one thing that we've kind of heard from parents about this. Low self-esteem and lack of family customs or traditions. As for protective factors, so they're the opposite of those risk factors. They're going to be what keep our youth safe. So having those strong, loving parent-child bonds, again, all these things are going to be encompassed into this program. Clear rules against alcohol, tobacco, and drug use. Parents set a good alcohol, tobacco, and drug use example. Mild, consistent discipline, monitoring child's activities and friends, school attendance and success, high expectations, having that involve parents, and then family customs and traditions. So this is a general overview. Again, I kind of said this is an 11-week program. And some of the things that are encompassed within this 11-week program are going to be my time. For those of you that aren't familiar, it's just setting aside some time for each individual child to have with their parents, something that the child enjoys doing. Having them have those healthy foods and family dinners, so having time to communicate with one another. Looking for the good, giving compliments, not criticizing each other. Love listening, which is going to be, love listening stands for, like, so it's LUV, which is listen, understand, and validate. So you're not just there absently, just like listening to the child, you're actually engaging in them. In other words, active listening. Said clear family rules and rewards, positive discipline, problem solving, and win-win negotiations, and mindfulness. So if you want to go to that next slide. Okay, perfect. So we start each check-in. So Mondays are going to be our lesson day, Wednesdays are the check-in days. And for each check-in, we start it with some mindfulness, which is a guided activity that encourages families to practice mindfulness at home even if it's just for like 2 minutes a day. And this is kind of where we get rid of those negative thoughts, because we tend to have those stressful thoughts by like at least the middle of the week. So it's a good time just to kind of debrief and relax a little bit. And you can go to the next one. Okay, perfect. So this is just an example of one of the things we do. We try to give the families activities that they can engage with, just so it's not us lecturing to them the entire time. One of the activities we do host with them are going to be the family conversation jar, because if we do manage to get the family to have that time that they allocate to eating family dinners together, they might have trouble, like, opening up with one another. So we don't want them to just sit there in awkward silence. So we do give them the family conversation jar. It has some prompts that they can kind of discuss, but this is just kind of a guide for them. So it gets that conversation going. They don't necessarily have to stick with just these, but it's just some options for them. I'm just going to go to the next one. Perfect. And then, as I mentioned, SFP also addresses substance use and goes over how to have conversations about drugs and alcohol with your kids, and how to set and maintain healthy boundaries surrounding substances, and how to create a safety plan. So with the safety plan, we also discussed that in our fentanyl presentation. So it's just how to get out of a dangerous situation prior to being in it. And then, so it's not just for substances in general, but again, if there's some other danger at a location that they're at, how to address that, how to get them out safely without them feeling peer pressured. Perfect. And so we do have our own life experiences, our upbringings, cultures, and childhoods, and they shape the type of adults and parents that we become. And of course, there are many different ways to create a strong family dynamic, and our world is always changing. So the world that we grew up in, again, we now have a lot of technology. It's not the same that these kids are growing up with now. There's a lot more dangers out there. And we try to learn as we go, but ultimately it's our job to help protect these children, help keep them safe. And then research shows that most youth substance use can be prevented by parents who are well-trained in 3 types of skills. These are going to be bonding, so creating these warm, loving relationships, setting those clear boundaries, and monitoring youth substances to see that they always stay in an alcohol and drug-free social environment. Yeah, and so just overall, in short, SFP offers an easy-to-learn family skills training to protect our youth. And although I'll be straight up honest with all of you, I'm not a parent, but these skills are so beneficial, just like for everyday communication. Like I've used this when I'm living with roommates, and it's really changed the dynamic in a very beneficial way. Oh, gonna go to the next one. Okay, perfect. So this is where you all can kind of come in and help a little bit. We are currently recruiting for this program. Again, this is 11 weeks. It meets twice a week. For this one specifically, it's Monday and Wednesday. The Monday one, again, is going to be that lesson day, meets from 5:30 to 7 p.m. and Wednesdays from 5:30 to 6:30. For the Wednesday class, we try to split it up between so 30 minutes and 30 minutes, with the first 30 minutes being for the parents. We can kind of address any issues that they've been having with the kids, maybe some skills that they need to help practice. And second half hour are just for the kids. Again, we give them that opportunity to voice any frustrations or concerns, but ultimately we try to keep it more upbeat, lighthearted. We play some games with them to help keep them engaged. But this one does run from August 14th to October 30th. And the last day to register for this class is August 7th, which I believe is coming up right around the corner next week. So if you do know anyone who might be interested, I will drop the link right here in the chat. But again, it's also going to be found on our website. And then if you're not able to make it to this one, we also have a link to our general interest form for future cohorts, and we can reach out to you. And then right here is going to be our list of just general presentations that I covered a little bit. So we do have a Rise of Fentanyl coming up on August 29th, as well as a QPR gatekeeper training on August 8th. And again, if you're not able to make it to either of those, we do have our general interest forms that you can fill out. We can reach out to you with upcoming presentations. And then if you do need to contact us, that is all of our information right there. I can help you with scheduling trainings, but if it's more Narcan related, if you want to get some at your organization, you can email the general team email. And that was all I had for today. So thank you so much for giving me that time.
Thank you so much. I appreciate it. So really quick, before we get off, I just want to give a quick update. So as you know this, our school's call is no longer 30 minutes. We're going to be hosting them now for an hour on the first Wednesday of every month. So our next call will be on September 6th at 1 p.m. I do also want to note that we will be starting a bi-weekly newsletter. So we'll be sending that out to y'all. So in case you missed it, or in case you need resources with links, we'll also be providing that within a newsletter platform. And then, of course, if you have any questions or concerns, our email and phone number is right here. And with that being said, I want to open up. Does anyone have any questions for either our epidemiology or our CMHA divisions programs? Okay. Seeing none. Yeah, Amy, if you need to, yeah, definitely, Amy, if you want to speak. Sorry, I didn't see the chat.
Oh, that's okay. Is this a good time? It's going to be really brief.
Yeah, definitely. Go ahead.
Okay, now, for the most part, I think the state is fairly clear. Some of this language can be difficult to interpret. I'm just including in the chat right now a brief 2-page bullet point link used up by a group up in Oregon that basically clarifies everything. Now, the important parts here to note is that you don't need to get a different waiver for every location. Okay, the entire district can have one CLIA waiver, but you need to post a copy of the certificate once you get it in each location that you test. And you need to make sure to indicate those addresses when you're filling out the original application. Okay, or when you're renewing your application every other year, you also want to make sure that the locations are all correct. And that's also kind of outlined a little bit in this thing I just linked. The other thing that's important to note that isn't always super clear, the one thing that CLIA will find, and for waived testing facilities, only roughly 2% are ever inspected in the course of a year, although that may change. But something that they do require is that every day that testing happens, you need to log the ambient temperature where the testing is happening and where the tests are being stored. It's as simple as making, you can just put a piece of paper with a brief spreadsheet that has a date and a temperature range. That's important to note. And the other thing is that the person who's running the tests, their initials need to be noted with the results, whether it's in an electronic system or whether it's in a paper system. Those records need to be maintained. The person who ran the test, the person who was tested, the results for 2 years. Does anybody have any questions for me on that basis? Okay. Obviously, if there are any questions going forward down the road, our team here will go ahead and punt them to me, and I can try to help you interpret the language. But that's the basics. Is you need to keep a record of who ran the test. You need to keep a record of the temperatures, and you got to post a certificate in every location, and that's mobile vans to brick and mortar schools. All right. Thanks, everybody. This was a great presentation, and I really appreciate the invite.
Thank you so much. Appreciate that. Okay. Seeing that there's no questions, thank you all so much for joining. Please be on the lookout. We'll be sending this recording as well as a couple of PDFs with the updated school guidance for respiratory disease and a couple of other things as well. And I'll stay on the call for a couple more minutes if anyone has any other questions. But if not, I hope you have a wonderful Wednesday and a great weekend.
Thanks, Chris.